Welcome back to the LGS show. I'm your host, Liam Sellers. Thanks once again for being here. Now, today, what I'm going to do on this episode is just break down all this information that we've received regarding COVID. It's going to be very substantive, but at the same time, we're going to try to be efficient. Now, I want to pretext this episode by saying I'm no scientist. I'm no epidemiologist. But what I do know is that I have an ability to research information, analyze data, and apply common sense. I think I have a right to speak on this subject. And also, last I checked, these epidemiologists aren't politicians, but yet, for some reason, they're unilaterally enacting public policy. So I think it's a wash. Before I delve into the details surrounding this whole pandemic, I want to quickly set the table by providing you two of numerous examples of media malpractice throughout this whole pandemic process that we've been experiencing. Now, what am I talking about? Particularly from our national news organizations, as well as social media to some extent, we are witnessing a crazy amount of just misleading information and in some cases pure propaganda. With these two examples, I want to illustrate to you what we're dealing with as a country. I know that I don't have all the answers. I understand that this is a complex issue, and I'm not here to downplay it. I understand the severity of it, but at the same time, I want to provide you with an alternative viewpoint and bring an element of composure, logic, and common sense to this equation. Now, the first example of media malpractice that I'm going to provide for you right now comes from no other than CNN, and it involves an interview between an anchor and an emergency room nurse in South Dakota who went viral for giving a detailed account of how patients that are dying of COVID-19 in her state are in complete denial about the virus and that their last words involve something to the effect that this is a hoax. Go.
Even now, the hospital is being overrun.
Now stop. I'm going to interject frequently throughout this. What she just said was simply not true. The hospitals in South Dakota are nowhere near overwhelmed. As recently as last week, 40% of the ICU beds are still empty. But hey, who am I to get in the way of a good narrative? Continue.
With COVID patients, they come in, they're horribly ill, they're gasping for breath, and yet they don't believe they have COVID?
Yeah, I think the hardest thing to watch is that people are still looking for something else and they want a magic answer and they don't want to believe that COVID is real. And the reason I tweeted what I did is it wasn't one particular patient, it's just a culmination of so many people. And their last dying words are, this can't be happening, it's not real.
To be blunt, that interview was disgusting. You have a nurse slandering dead people who don't even have the ability to defend themselves from this slander and alleging that their last words are something to the effect that the virus is a hoax. It was disgusting. If you actually did some research on it, a courageous reporter went out to South Dakota and started calling other hospitals. There was no corroboration of this nurse's story whatsoever. CNN decided to run with it. In fact, one nurse said, yeah, I haven't had that experience here in South Dakota. Just a complete falsehood. But let me remind you that CNN is not a legitimate news organization. They are a DNC propaganda operation. You heard that correctly. Any of the medical professionals you see on TV, whether they're scientists, doctors, nurses, let me tell you what they are. Propagandists. Yes, propagandists. And they do not deserve our respect. They're on TV promoting an agenda, promoting themselves, or promoting a narrative. The people that I respect are the frontline workers that you don't even hear of, that are working 24-hour shifts, saving lives, and serving their fellow citizens. Those are the people that I respect. So they're not looking for praise, recognition. They're just here to do their jobs. Now, the second example of media malpractice surrounds the news of the vaccine. Coincidentally, or rather conveniently, Pfizer announced the Monday after the election that the efficacy of their new vaccine reached about 90%, and the Trump administration, took a little credit for it under Operation Warp Speed, which was the initiative set out by Trump to develop a vaccine quickly and effectively. This partnership created this result to which Orange Man bad, Pfizer representatives went out and immediately distanced themselves from the Trump administration because it's bad PR. You can never give the Orange Man credit. And the media ran with this. Washington Post saying, yes, this was not a part of Operation Warp Speed. The simple fact is it was. Pfizer clarified the record and said, we are on the supply side of this operation. So media hysteria saying that Trump is taking false credit. Pfizer goes out and corrects the record and says, yes, we are a part of Operation Warp Speed. By the way, I can do that all day long. There are countless examples of media malpractice throughout this pandemic, but I just wanted to give you two quick examples to establish some context and illustrate to you what we're going up against, which is a barrage of lies and misinformation. Let's get right into this COVID subject. Since all roads lead back to this individual, I want to start the conversation by bringing up Dr. Anthony Fauci. The Fauci, the political bureaucrat. Whoa, Sellers, how rude. He's a scientist. He's a doctor. He's the nation's leading infectious disease expert. And he's a political bureaucrat as far as I'm concerned. You probably had no idea who he was not that long ago, but you certainly do now, whether it's GQ photo shoots, throwing out first pitches that are more inaccurate than his predictions, his name on your girlfriend's underwear, which shout out to him, it's kind of cool, or making countless TV appearances virtually every single day. He's the anointed one. He can never be challenged. He can never be questioned. He can never be doubted. He's America's doctor. He's probably going to be Time Magazine Person of the Year. He's the anointed one. If someone's been elevated to that status and has been delegated a lot of responsibility and power, I think it's fair that we can scrutinize his performance. And I'm just going to be straightforward with you. His performance throughout this whole pandemic process has been, at best, inconsistent, and at worst, a disaster. Now, I'm not here to attack Fauci's character or his credentials. In fact, I think he's probably a nice guy and well-intended, but he's capable of error, just like the rest of us. He's not perfect. My biggest frustration with him has been his ability to contradict himself at virtually every single turn throughout this entire process. And he's done it multiple times, whether it's mask or no mask.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. The fundamentals are not rocket science. It's universal wearing of masks.
Now, cut. People are going to say, well, Sellers, that was taken out of context. We just didn't have advanced knowledge of mask wearing and its effectiveness, which I will challenge later in this episode. Okay, that's fair. We didn't have enough knowledge of it. Then why is he on TV making these general platitudes and these doomsday predictions without having such knowledge? And why is it that he's the only guy that we can refer to in terms of our national dialogue / conversation surrounding this virus? How come we can't take into consideration other like-minded medical professionals or scientists who have the same qualifications? How come we can't take their opinions into consideration? I think that's a fair question. But that's not the only example. He's contradicted himself on the severity of this virus.
Dr. Fauci, coronavirus, of course, has been in the news so much. People are worried. Should they be worried? Are they worried unnecessarily? And what should they be doing?
No, I don't think people should be frightened. I mean, the risk right now, today, currently, is really relatively low for the American public. The reason it's serious is that a question that was asked by Dr. Harris is that the mortality of this is multiple times what seasonal flu is.
Cut. Now, I want to propose to you something. The left likes to say two things simultaneously at once that contradict each other, whether it's Trump didn't listen to the scientists and the scientists are never wrong. It's got to be one or the other. Now, let's look at this objectively. Let's look at that time period, late January, early February. Trump was listening to the scientists, and he was operating off that advice, one way or another, to some effect. Hey, don't blow this out of proportion. Let's relax. Let's calm the public. This isn't that serious. Worry about the flu. He was operating off that advice. Now, granted, we didn't have knowledge of the lethality of this virus, the features of it, its sophisticated nature. I get it. So Trump is operating off of that. It can't be that they're right and that he didn't listen to them. It's got to be one or the other. And also take note of the time period as well. Once again, late January, early February. What was happening? Trump's impeachment. You know damn well if he decided to talk up the importance and the severity of this virus, that he would be accused of over-exaggerating it and distracting the public from his impeachment. That's exactly what would have happened. That's not it. There's also another example of Fauci contradicting himself regarding school openings. Go.
And that there may be some areas that the level of virus is so high that it would not be prudent to bring the children back to school. But as I said in the past, and as you accurately quoted me, the default position should be to try as best as possible within reason to keep the children in school or to get them back to school.
Cut. Notice how he says, oh, well, thank you for addressing my record of being consistent and saying that I'm for school openings. That's just not true. I just gave you a segment where he said that's just not possible, school openings. And what he's doing is taking the politically convenient position and saying, yeah, I was always in favor of schools once the science suggested that schools are safe. No, that's just simply not true. And Donald Trump, Scott Atlas, and Rand Paul have for months been pushing for school reopenings. The science has been there for quite some time. This isn't a recent development. Have you ever noticed when Fauci does TV interviews, he's typically doing a lot of one-on-one stuff by himself, as you can see here. He's never on a panel with equally qualified individuals that might be able to challenge his expertise, his judgment, his predictions. Typically, he does these interviews with low IQ anchors that lob him softballs so he can just spew out whatever he wants to say, uncontested. I took notice of that, and I realized that when you actually challenge him, he becomes disgruntled, and you can expose a lot of holes and hypocrisy in his arguments.
Protests increase the spread of the virus.
Do protests increase the spread of the virus? I think I can make a general statement.
Well, 500,000 protesters on June 6th alone.
Yeah.
I'm just asking that number of
No.
people, does it
Yeah.
increase the spread of the virus?
Crowding together, particularly when you're not wearing a mask, contributes to the spread of the virus.
Should we limit the protesting?
I'm not sure what you mean. How do we say limit the protesting?
Should government limit the protesting?
I don't think that's relevant to.
Well, you just said if it increases the spread of the virus, I'm just asking, should we limit it?
Well, I'm not in a position to determine what the government can do in a forceful way.
Well, you make all kinds of recommendations. You,
No.
you make comments on dating, on baseball, on everything
No.
you can imagine. I'm just asking you just said
Yeah.
that protests increase the spread.
No.
I'm just asking you, should we try to limit the protests?
No, I think I would leave that to people who have more of a position to do that. I can tell you.
Government
that-
stopping people from going to church, Dr. Fauci?
Yeah.
Yeah, oh well, yeah, it kind of sucks, yeah. 100,000 restaurants nationwide closed, 40% of them never coming back. Yeah. A third of New Jersey and New York small businesses closed permanently. Yeah. Tough, yeah. Dr. Fauci, how am I going to feed my kids? How am I going to pay my rent? Yeah. I have my job. I have my pension. I have my health care. Notice the groups that are advocating for additional lockdowns. Politicians, public health officials, celebrities, teachers, media personalities. Notice a commonality between them. They get paid regardless. They have consistent income. Lockdown, pandemic, no lockdown, no pandemic, they're fine. Go.
I'm not favoring anybody over anybody. I'm just making a statement that's a broad statement that avoid crowds of any type, no matter where you are, because that leads to the acquisition and transmission. And I don't judge one crowd versus another crowd.
Cut. Yes, he does. What he just said was demonstrably false. In fact, Fauci does favor certain crowds over others. Remember those lockdown protests in April that occurred in various locations throughout our country in which people were petitioning these egregious and draconian lockdown measures imposed by numerous governors? Fauci was quick to condemn that behavior. In fact, he did it immediately. So what he just said was a flat out lie. In fact, many of our top public health officials endorsed the summer protests, which were way larger. I mean, not even close to the anti-lockdown protests in April. But yet they'll sit there and question, oh, how come the public doesn't believe us? How come these right-wing conspiracy nuts don't listen to us? It's because you're hypocrites. Continue.
I don't know how many times I can answer that. I'm not going to opine on limiting anything. I'm just going to tell you.
You've
as a
opined on a lot of things, Dr. Fauci.
Yeah, but I've never
This
said
is
to
something that
limit
directly
anything.
impacts the spread of the virus, and I'm asking your position on the protest.
Yeah.
Oh, but Sellers, he's a scientist. He's not a politician. So excuse him if he's not as polished. No. That's exactly how a politician answers a question like that. Dodging the question, being evasive, not confronting it directly. That's exactly how a politician answers that question. And mind you, Fauci's been in government for 50 years. To put that in context, that's longer than Joe Biden. You don't stay in that position by just being some guy. You have to be shrewd, you have to be a political operative, and you have to know how to game the system. He answered that question precisely like a politician. Let's not sit here and say, oh, he's a scientist, so he doesn't know what he's... No, he knows exactly what he's doing. But some of you might say, oh, that's just an isolated incident. He just had an off day. It's an outlier. No, next scene.
You've been a big fan of Cuomo and the shutdown in New York. You've lauded New York for their policy. New York had the highest death rate in the world. How could we possibly be jumping up and down and saying, oh, Governor Cuomo did a great job? He had the worst death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. They got hit very badly. They've made some mistakes.
Like stuffing COVID-infected patients into nursing homes. Just a little mistake. Go.
Right now, if you look at what's going on right now, the things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Cut. Fauci did praise New York's performance, despite the fact that what transpired in that state was an absolute catastrophe. But take a look at Florida, for example, when they eased COVID restrictions in late September. Fauci was quick to jump on it and criticize it, saying it was very concerning and that they're asking for trouble, despite the fact that as of December 6th, New York had more hospitalizations, more cases than Florida. New York right now is experiencing a much higher surge per capita in both hospitalizations and cases in comparison to Florida. Where's Fauci recently? What's he got to say about New York? Are they still doing it correctly? Are they the model to follow? And is Florida still a disaster? Is Florida still doing things incorrectly? Has he said anything about Florida? Continue.
Or they've developed enough community immunity
Right.
that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York, it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
There's also the pre-existing immunity of those who have cross-reactivity, which is about a third of the public in many estimates from studies, which would actually get you to about.
By the way, the study that Rand Paul was referencing suggested that about 43% of the population may have some pre-existing immunity to COVID-19, which is still substantially lower than the 60% threshold that's needed to achieve herd immunity. While it didn't vindicate Rand Paul, it certainly didn't make him look like he was a Looney Tune and that Fauci was like, you're alone in that, the way Fauci was trying to characterize him. I'm trying to emphasize a larger point here, actually. This is why Fauci goes uncontested, unchallenged, and virtually by himself in every interview on TV that he makes. It's because the minute he's challenged, he resorts to subtle ad hominem attacks, mischaracterizes people's positions, and becomes discombobulated. Lastly, this is my final point concerning Dr. Fauci. He is merely a symptom of a much larger issue, and that is this creation of an oversized, intrusive federal bureaucracy in which career government workers / unelected bureaucrats influence our public policy and regulate basically every aspect of our lives. And we've allowed this to occur. And now we're reaping the ramifications of that. Next subject. I want to talk about the most controversial and dangerous drug in the world. Fentanyl? No. Hydroxychloroquine. What? Yeah. The anti-malarial drug that has been considered safe for the past 65 years or so came under heavy fire from our news media when President Trump came out in favor of it. And since President Trump was in favor of it, it must be automatically bad and opposed at all costs. So notice what the media did during this debacle. They tried to throw anything at the wall hoping that it would stick. Oh, Trump has a financial stake in it, despite the fact that he had maybe $1,000 invested in it and he wouldn't profit off the stock performance whatsoever. Debunked. Oh, it's rare. It doesn't really work. It worked in a couple patients. Wrong. It actually worked in thousands, if not tens of thousands of patients who were really ill with COVID-19 and saw promising results to the point where they were effectively treated. Personally speaking, I knew one person that was really ill with it, took hydroxychloroquine, and got better within a week. So very promising. Oh, but Sellers, that's just anecdotal. That was the thing that Fauci argued. Oh, it's just anecdotal. We don't have any scientific studies. Well, let's correct that.
Now 53 studies that show positive results of hydroxychloroquine in COVID infections. There are 14 global studies that show neutral or negative results, and 10 of them were patients in very late stages of COVID-19, where no antiviral drug can be expected to have much effect. Of the remaining 4 studies, 2 come from the same University of Minnesota author. The other 2 are from the faulty Brazil paper, which should be retracted, and the fake Lancet paper, which was.
So the science indicates that hydroxychloroquine is an effective treatment for COVID-19, yet the psychotic governor of Michigan threatened sanctions and penalties towards doctors who prescribed it to their COVID-infected patients. Just absolutely insane, right? Well, to those of you who are watching that are proponents of universal healthcare, Medicare for all, whatever you want to call it, I want you to take a strong look at this. What you see here is a small glimpse of what you will get should we go down that route of single payer in this country. Look at the VA, government ran, absolute disaster. But I'm talking about something even more important here. This idea that an unelected bureaucrat or a politician in DC or in your state can determine what medications you can or can't take, even if they are potentially life-saving. That should frighten you. Your health is the most valuable and vulnerable asset that you possess. And government has no business interfering with that, whether it's in the medical room, your medications, whatever you want to call it. That's between you and your doctor. The bureaucrats don't know who you are. They don't know about your medical history. They don't know about your physical condition. So the idea that they can dictate what medications you can or can't take should be frightening. And that's exactly what you're signing up for should you go down that route of government-run healthcare, Medicare for all. The biggest lie you're being told right now is that our hospital system is being overwhelmed and thus we need a lockdown again. That is just a flat-out lie. Now, anecdotally speaking, I know people that work in emergency rooms and in hospitals in the LA area, and they're nowhere near overwhelmed. In fact, a lot of people are coming in that have mild symptoms, either a cough, itchy throat, whatever the case may be, exaggerating. They can't be turned away, obviously, so they get tested for COVID-19. And plus, if you stay in a hospital for longer than 8 hours, you're considered a hospitalization, even though if you went home that same day. So a lot of what you're seeing is misleading. Now, I know that's anecdotal, but I also have the science to back it up. Nowhere in this country, whether it's today or in March, have our hospitals been overwhelmed. In New York, it never happened. They had the Javits Center and that ship that pretty much just sat there. They were empty. In Houston, they were predicting doomsday. It never got overwhelmed. In Miami, they were predicting doomsday. It never got overwhelmed. In LA, actually last year at this time, we had a higher percentage of people in the ICU than we do currently today. And in LA County, we're about at 85% ICU capacity, where in the last couple of years in flu season, we were near 100%. So what you're seeing is a lot of panic in order for you to comply and give in to these tyrannical measures. And remember what the purpose of this whole lockdown situation was for. It was to flatten the curve, save up hospital space. Well, we've done that. And don't take my word for it. Take it from one of the many doctors that know this to be true.
There's plenty of healthcare capacity now. We know a lot more about the virus, who gets it, how to treat it, who's at risk. So there's no reason to continue to shut down the economy.
After hospitalizations, the next scare tactic the media deploys on the public is cases and subsequently deaths. And just like the hospitalizations, which I provided context for you, this also has context as well. And I'm going to take a step back here. I'll start with the cases. But first, notice the narrative shift. In April, it was death, 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 death. Then in the summer, it was cases, cases, cases. Now it's death, cases. Whatever infuses chaos on the public, the media runs with it. And they try to scare us. Now, let's do cases first. Let's start with their testing. We conducted, on a daily average, over the course of last week, almost 2 million tests a day. That is by far way more than any other industrialized country or pretty much any country on the face of the planet. So as a result, when you increase your testing capacity, you're going to have an increase in cases. It's inevitable. And most of them are asymptomatic that don't require any hospitalization or treatment whatsoever. But also, I want you to take note of the sensitivity of our testing. In many ways, our testing produces a ton of false positives and is extremely volatile because the PCR method has a way of detecting dead coronavirus remnants that have been in your system for quite some time. And don't take my word for it.
Several months ago, the New York Times did a huge story on the sensitivity of our PCR testing, what the threshold for a positive test was. We have seen scores of false positives in the NFL, where they have some of the best private healthcare in the country. Penn State football reported a few weeks ago they have had 44 false positives within their football program. Are we overblowing this with the sensitivity level that we are putting on our testing in America?
Well, the answer is, of course, because the testing that's done using a technique called PCR detects both infectious, contagious people, as well as pieces of virus that are neither contagious nor even functional. So they get pieces of dead virus. This is a kind of esoteric stuff that has now made its way into popular discussion, which is good. That is that the PCR tests themselves, depending upon the way you do them, are showing basically false positives.
Oh, but Sellers, you just cited Dr. Scott Atlas. Isn't he controversial? Yeah, about that. The media is so pathetic. They basically parrot the same talking points while using different phrasing. In that scope, Dr. Scott Atlas is controversial because he, A, doesn't advance their COVID narrative, B, he doesn't give into the fear porn, and C, he doesn't agree with Fauci on everything. So, as a result, he must be character assassinated at all costs. Dr. Scott Atlas provided a unique approach to the task force in that he wanted to take everything into consideration. He approached it with the big picture in mind. There are other consequences of this crisis aside from COVID, and that these economic lockdowns result in adverse health effects, whether it's depression, suicide, substance abuse, and that we have to take that into consideration. Also, we have to open schools. The devastating consequences of these lockdowns are seen through our children. As a result, he was attacked because he didn't adopt the same approach that the media had already accepted. They had to smear him. And one of the cheap shots they gave was that he was inciting violence because he urged Michigan people to rise up against Governor Whitmer's authoritarian lockdown measures. He wasn't inciting violence. Everyone knows that. He was encouraging civil disobedience, which I thought was cool, right? Didn't we just have a summer of peaceful protests? Wasn't that acceptable? Arguably, the most misleading aspect of this whole pandemic has been the death count, the death rate, and the way that deaths are reported. What you see in our public discourse is an absolute misrepresentation of the actual number of deaths. So I'm going to break it down from a statistical perspective, and then I will break down the methods in the reporting of death. First and foremost, it's important to note that the way we're being portrayed in the media and international media, that COVID is running rampant and is an absolute disaster, and the US is the worst place to be in the world. Now, I'm not saying it's not a serious problem in this country. However, if you take it on a per capita basis amongst advanced industrialized nations, we rank 9th on a per capita basis in terms of COVID cases and COVID deaths. Also, recently you've been seeing reports out there of how 2,000 some odd people a day are dying of the virus. It's happening every day. It's like 9/11 all the time. That is extremely false. If you actually read the CDC's website, the death reported is not equivalent to the actual deaths that occurred on that day. It takes time to process and certify these deaths. No, 2,000 people didn't actually die today. It takes, in some cases, days, weeks, and months to certify deaths resulting from COVID-19. Now, I'm not saying that there isn't death, but these are accumulated over time. It's just a matter of when they got reported. So it's entirely misleading. It's not 2,000 people actually and physically dropped dead today at this moment. Let's switch to how these deaths are actually being counted. Unlike virtually every country in the world, the US counts everything as a COVID death. And no, that is not a right-wing conspiracy theory. Take it from the Illinois Director of Public Health.
Technically, even if you died of a clear alternate cause, but you had COVID at the same time, it's still listed as a COVID death. So everyone who's listed as a COVID death doesn't mean that that was the cause of the death, but they had COVID at the time of death.
Take it from Dr. Deborah Birx, the White House Task Force Coordinator.
And let's say the virus caused you to go to the ICU and then have a heart or kidney problem. Some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it. The intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
So it's not a conspiracy that the death numbers are highly skewed. That's because we are classifying anything that is COVID related as a COVID death. You can have heart disease, you can have lung disease, you can have liver disease. If you had COVID at the time of death, you are counted as a COVID-19 death. In fact, a CDC study indicated that only 6% of the quote-unquote deaths in this country are a direct result from COVID itself. I think COVID might have contributed to their deaths, sure. But also, are you here to tell me that if all these other people with heart disease that are in their 80s, which is the median age of death, in their 80s with lung disease, liver disease, kidney disease, cancer, that they would still be alive had it not been for COVID? It's a misleading talking point. Every other country classifies it as a heart death, a lung death, depending on what the comorbidity is. We are highly skewed in this, and we are the only country that's doing this by counting deaths with COVID and deaths from COVID as one and the same. By the way, I just wanted to point out how it's intellectually dishonest to compare our COVID situation to that of other countries. People will say, how come we can't be like New Zealand? They got the virus contained. Yeah, how come we can't be like New Zealand, a small little island in the Pacific Ocean with a population of maybe 5 million people? How come we can't be like South Korea? They got the virus under control. You know what South Koreans have under their control? Their diets. They have one of the lowest obesity rates in the world, whereas the United States has one of the highest obesity rates in the world. And people are like, really? Is that true? Do Postmates for a day and you'll find out very quickly why that is. Also, COVID hits those with obesity the hardest. So when Americans want to stop looking at a piece of chicken, thinking of ways to fry it, butter it up, slap some cheese on it with a Thousand Island sauce, with a side of fries and an Oreo shake, maybe I'll take that argument into consideration. People will be like, well, look at Europe. They did a great job with it. Europe has a higher death rate than the United States. despite the fact that they've imposed stricter and harsher lockdowns. So when we're comparing ourselves to other countries, it's like comparing apples to oranges. Now let's get to the subject of mask wearing. Let me start by saying this. I'm not anti-mask. All you hear now is wear a mask, wear a mask, wear a mask. If you don't wear a mask, you're a terrible person. There's mask Nazis all over the place, shaming people for not wearing masks. Let me just put it like this. I think there's a time and a place for everything. If you're inside a store, if you're inside a restaurant, and there's a congregation of multiple households, absolutely wear a mask. But if you're in your car by yourself, if you're outside in your neighborhood walking your dog with no one around you, then you don't need to wear a mask. Now, if you want to, that's entirely up to you. That is within your prerogative. You should do whatever you feel makes you comfortable. But on the inverse, you shouldn't shame those that aren't participating in that same behavior, especially when there's no need to wear a mask. Now, the reason I want to briefly tackle this subject is because there is an all-out effort to condone mask wearing. Do not question mask wearing. Do not question the effectiveness of masks. And anyone that dares questions or challenges it is immediately ostracized from the discussion. Let me just put things into context here. The largest study in the world regarding mask wearing and its effectiveness in preventing you from getting COVID-19 was conducted by a study in Finland. So it was a Danish study. To summarize it, I read it. Ultimately, they concluded with 95% confidence that there is no statistical significance between contracting the virus whether you wore a mask or whether you didn't wear a mask. Now, this same study didn't advocate for not wearing a mask. In fact, they encouraged mask wearing when necessary and social distancing. All they were trying to prove was that there's no statistical difference, at least from their observations, that masks were effective in preventing you from contracting the virus. It was a valid study. In fact, the confidence interval ranged from 46% reduction in contracting the virus to 23% increase in contracting the virus. They did that with a 95% confidence interval. In some cases, depending on the range, you're more likely to contract the virus with a mask than without a mask. And it's just something that I thought was very interesting because we're constantly told, do not question it, mask work, mask work, mask work. Well, I'm not saying they don't, but there's not definitive proof that they do. It's a gray area at best, in my opinion. Now let's look at the numbers and the charts to get more into depth. Let's take a look at areas in the United States with mask mandates. Let's start with the state of Kansas. You could see these two lines here. On one line, you have counties with mask mandates. On others, you have counties without mask mandates. Shortly thereafter, you notice a pattern. The counties with mask mandates had a much higher growth of new cases than the counties without mask mandates. You look at West Virginia, they imposed a mask mandate some point in July. Cases shortly thereafter skyrocketed. You look at Colorado, the same situation. By the way, I can do this all day. I have plenty more charts that prove my theory here. But the point I'm making is I don't see a correlation between mask mandates, and reducing the spread of COVID-19. I'm under the impression that COVID is just going to run through communities. We're not going to escape nature. We're not going to be able to outrun it. It's going to run its course. And people are going to say, well, that's just because people don't wear masks. YouGov poll conducted suggested that 80% of Americans at least are wearing masks when they leave their house. And it's everywhere you go. And a lot of places mandate that you wear a mask if you enter their business. All I'm trying to say here is it's okay to question the legitimacy and the effectiveness of masks, and you're not a bad person for doing so. I want to quickly address the sharp contrast coming from the left and the media towards President Trump in comparison to China in terms of who to place blame for this pandemic. It's like night and day. When it comes to Trump, he's guilty of murder. He had a criminal response. He has blood on his hands. But when it comes to China, you can't call it the Wuhan virus. They're pretty much mutes. And take a look at what Joe Biden has planned moving forward in terms of disciplining them for this pandemic. Go.
It's not about punishing them for the COVID virus. It's about insisting that there be international norms that are established that they play by.
Just appalling. What does that even mean? We're going to make them adhere to the international rules. That shouldn't be a punishment. That should just be the standard, pandemic or not. The truth is, he's soft on China. He's pretty much going to give him a slap on the wrist, and they are ecstatic that he's going to be the next president. Let's go back to the reason why we're in this mess to begin with. China is the only country to blame. The virus originated from there. They lied about it. They covered it up. They didn't allow WHO or American scientists to go into Wuhan and investigate what was going on. They cut off travel from the mainland into Wuhan, but let international travel continue. They unleashed this pandemic on the rest of the world, and they hoarded all the PPE in advance. They are the number one culprit of this situation. But once again, the media and the left would rather engage in vicious, cheap shot attacks against the president and pretty much just stay silent on China's role in all of this and let them slide. It's reprehensible. The most infuriating part of this whole pandemic has been the obvious hypocrisy of our elected officials. Let's run through the list real quick. You got Gavin Newsom in California, the governor, was caught eating indoors with no mask, social distancing with multiple households at the French Laundry, violating all his COVID-19 measures. Next, you got Nancy Pelosi inside a hair salon without a mask, getting treatment on her hair, which subsequently led to the closure of that business the following day after she got caught and immediately blamed them. Let's transition to White House reporters who constantly berate and accuse the president of not wearing a mask when he's conducting press conferences or going about his daily life. When the cameras aren't watching, they both remove their mask. No shame whatsoever, just absolute hypocrites. Let's transition to city mayors. You have the Denver mayor urging all his residents to stay home for Thanksgiving, do not travel, do not gather with your family members. And then he hops on a flight 30 minutes later to go visit his family down in Mississippi, I believe. Then you have the mayor of San Francisco going to dinner at the French Laundry the night after Gavin Newsom was there, despite the fact that it's against the guidelines of California. Again, more hypocrisy. You also have the city of Austin. The mayor there was down in his timeshare in Cabo San Lucas with multiple households, I think like 8 people total, urging people in Austin to not gather with their families, to not travel. So what you see here is just absolute hypocrisy. And it should tell you everything you need to know about this whole thing. It's about control and it's not about your health. These elected clowns don't even believe in the protocols that they're enforcing. That should tell you everything you need to know. But the sad thing is, a lot of people just don't see it. And people are like, well, I listened and I didn't do it and I didn't gather. Like, that's not fair. You voted for that mess. You reap what you sow, buddy. I don't feel sorry for you. And you're an idiot for complying with that. Also, they're just going to keep doing this until you hold them accountable, until you fight back. Aside from that, they pretty much are invincible and they can get away with anything. And they're going to. And I don't blame them. If I were Gavin Newsom, I would shut down the entire state, which actually he's about to do. I would put all of you on house arrest, and I would invite all my donors, all my lobbyists, all my family, and I would throw a massive party in the governor's mansion, something to this effect. And as a result, I would get up the next day, hold a press conference, look California right in the eye and say, yeah, I did all that. What are you going to do about it? And you know what California's going to tell him back? Nothing, sir. We're going to overwhelmingly re-elect you in 2022. So until you start getting that message, they're just going to keep doing this, and you have no one to blame for the hypocrisy but yourself. But I'm giving ourselves a round of applause. We just cured the flu. Oh yeah, according to the WHO, CDC, the flu is basically insignificant. It's gone. So let's give ourselves a hand. To wrap this one up, I know this was a super long episode, but I appreciate you sticking with it because this is the most important episode I've ever made. Trust me, I can go on for another hour, but I hope that you were able to capture the gist of what I was saying. Ultimately, our national response, dialogue, and approach towards this virus has been driven by 95% politics and 5% science. And it's unfortunate that it has. Hopefully, there's a light at the end of the tunnel approaching soon with these vaccines arriving, but I don't know. We'll see what happens. Aside from that, thanks for sticking this one out. Have a good one.